Hey, it's Dr. Jerry, and I have my patient John here, and he came in to me complaining of a long history of neck pain radiating down to the right arm. He's got a problem, pinched nerve in his neck. He's got a little bit of disc degeneration, some spurs in there that were really creating a lot of problems. So now we're seeing him for follow-up, and we'll go through the exam, and we'll ask him, John, you doing okay?
Yes.
Yeah, good. So any pain down the arm?
Much reduced the pain.
Yeah, so when he first came in, he was having a lot of difficulty sleeping,
Yes.
couldn't get comfortable, yeah? And now he was also having some difficulty at work. He works in an office, he's a manager of a company, and a lot of difficulty doing his normal day-to-day. Any pain with that?
Pain is much reduced now.
Good.
There is little backside.
Any pain with that?
No.
Good. Any pain with that? Good. So when we first did the exam on him, he really couldn't even tolerate bringing his head back. He had pain down the arm, he had pain into the shoulder area. The pain now has centralized, which means it's come out of the arm, it's come back into the neck where the problem is. It's now principally in this posterior shoulder area. So this is a very common situation with patients who have problems in their neck. Even though the problem is in the neck, it can radiate down into the arm, it can radiate into the shoulder area. And this is because the nerve is being affected. Okay, so I'm using the hypervolt in here just to loosen up this trapezius muscle. We need to get some drainage in here to get some of the inflammation and tightness out of here. Because even though the problem isn't really here, if the muscles are tight, as the nerves exit out of the neck and into the shoulder area, they can kind of be squeezed by these tight muscles. Any pain with that?
Much reduced, but there is.
Yeah. Check it. Any pain?
Backside.
Any pain?
No.
Any pain?
Backside.
Okay. Okay, now I'm going to use the impulse instrument, which is a chiropractic adjusting tool, to open up these areas that are locked down. They're fixated in the thoracic or the middle back. We'll move it up into the neck area to get some additional movement in the cervical spine or the neck. So what it's all about is restoring normal motion to these areas of fixation, so he can adequately move. We can get some inflammation, drainage, and reduction in the tone of the muscles, and more movement into the joints. And the better the joints are moving, they're going to send what's called proprioceptive feedback into the brain to help reduce the pain. Yeah? Blow it all the way out. Blow out that breath. Blow it out. Blow out. Good. And turn. What we're doing to treat this upper trapezius spasm is we're doing some dry needling as well. That's really helped reduce the upper trapezius hypertonicity and gotten some good results with that. Okay, last thing, you know what time it is, right? It's time to show me your exercises, yeah? So we've been working on this with him, and he's done a really great job over the last several weeks at perfecting his exercises. So doing here are these chin retractions, and what these we use for is to get that normal motion back in. This is something he does at home. Just slow it down just a little bit, and you wouldn't think that a simple motion like that would have a big result, but it does over time. He's gotten that pain to be reduced on his own. He does those about 3 or 4 times a day. Perfect. Okay. All right, John, show me your postural exercise. Okay? So step 1, shoulders back. Rotate the arms out, tummy tight. Tummy tight. And chin. Perfect. So now we're having him do Brugger's exercise, and again, because he sits at a desk all day long, what we want to try to get him not to do is that forward head posture, yeah? Because that puts a lot of drag, stress, and strain on those cervical nerve roots, the nerves that come out of the neck that give him the arm pain. So it's all about optimizing function, restoring normal motion, and then correcting some of the postural faults that create the issue.
Exercise.
Great job. Yeah.